Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, NPTE, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing algorithm, and full length practice exams. You can get a free trial of any course by going to achievable.me. And if you like it, be sure to use the code podcast to save 10%. Now, let's get started. Today, we've got Yulius Haryadi. Hopefully, I pronounced that correctly. And I would love for you to introduce yourself and anything about you sort of that makes you relevant to this episode.
My name is Yulius Haryadi. I'm an internal medicine physician working here in the US. I work as my main job is primary care physician, but I also take shifts for a hospitalist per diem. I'm originally from Indonesia, so I'm what you guys people usually call as a non-US IMG. And one of the things, other than practicing medicine and helping patients, I'm passionate in helping non-US IMG just like myself to be successful, to match winning to get into residency and become a licensed practicing physician in the US.
Yeah, fantastic. And IMG, just in case anyone was wondering, stands for International Medical Graduate. A big part of that process is preparing for the USMLE Step 1. So, my first question to you is let's talk sort of broadly if you're working through either undergrad or whatever kind of grad school situation that you're in, and you're thinking about going to the US to become a practice licensed physician and practicing there, when do you start thinking about it and when do you need to start this whole process?
Well, when you start thinking about it can be as early as even before you go to medical school, I guess. But I think a lot of people, depending on their country, they gonna start thinking about it during somewhere around the first, second year of the medical school. But it really depends on how much they get exposure on the information on how to become a licensed practicing physician in the US, because there's a lot of options. You can, for example, for Indian people, they can go to Saudi, they can go to China, they can go to Europe, they can go to a lot of places that we can actually go and become a licensed practicing physician in a different country. So it depends on how much exposure you got about the USMLE now. So it can be as early as first, second year. It can be as late as a fourth year, or even after you graduate. And some people decided to come to the US to become a licensed practicing physician. But ideally, if we're talking about ideally, you should be at as early as possible, because then you can actually prepare the curriculum, because the curriculum is going to be very, very different. Like, I'm from Indonesia, and I can tell you that the curriculum is very, very different. Like in Indonesia,
Mm-hmm.
the endemic things are all like TB, like worms, parasites. They barely talk about that in the USMLE. And in the USMLE, we have ticks like Lyme disease. We don't have any of that in Indonesia. So I never learned or really familiar with Lyme disease, with the clinical manifestations and the workup, etc. So it's very useful if you prepare it very, very early.
So what year of college are you thinking about this?
So now I think I need to clarify a little bit. In the US, when somebody tries to become an MD doctor, they do the undergrads and then they go to the medical
Yes,
school.
right,
So as an international medical graduate, a lot of the schools goes to medical school directly.
right.
So that's one thing. Don't confuse between, oh, you prepare it from the undergrad. Well, there's no such thing as undergrad. We just go to the medical school. And again, really, the preparations would be like a way, like even from the first year, you want to start preparing for the USMLE Step 1. Start doing the questions that related to USMLE, because again, the curriculum is very, very different. If you want to be like super, super ideal, you want to take the USMLE Step 1 because it's a basic science, would be right after you're done with the basic science and going for the clinical. That would be actually the best time, because it's going to be painful to relearn all those anatomy findings like S1, L5, which nerve supplies what muscles, and those are really all the basic science. When we move on to the clinical, we focus on the clinical manifestations, the approach of disease. If the patients pass out, what should we do, what are the questions we need to ask, those are clinical. We stop asking for where is the vagus nerve actually in your brain, things like that. So it's best if you take it right after you finish with the preclinical because the information are still fresh. So theoretically speaking, that would be the answer. But yeah.
Yeah. Do you feel that the USMLE Step 1 in particular, which is the preclinical portion, sometimes covers things that aren't covered by international medical schools in their normal curriculum, and that you have to kind of go outside of it to like study chemistry more or something like that?
I would say yes. Yes, I would say so. I can give you a specific examples. In USMLE Step 1, we're talking about receptors, G receptors, where a certain medication will bind into that receptors, and then through a series of chemical reactions, which we have to memorize, leads to some kind of like effect, whatever that medication is trying to do. Back when I did my medical school in Indonesia, we learned about, yes, that receptor exists, but they never test me about it. While in the
Right.
USMLE, they test you extensively which one is actually increased. Is it the CAMP? Is it the CGMP? Or is it actually decreased? Or it becomes very, very specific. So yes, definitely there are some part of the curriculum that they really test you heavily upon in step 1, but they don't actually teach you in the other medical curriculum.
Yeah, so
Um,
when you're preparing for the USMLE Step 1, how do you sort of triage that problem? How can you figure out best what are things you've already learned and what are things that you haven't already learned, and how do you get the resources to learn the things that are missing?
okay, so the answer to that is very simple. Get the correct materials.
Hmm.
So I don't want to get ahead of myself, start talking about materials, because there is one thing that I have to emphasize, which is my philosophy here in learning a USMLE. That I strongly believe that the materials, even though it's important, it's not the main thing that's important. The most important thing is you learn how to study it. And
Hmm.
the way you study it is to always exert evidence based learning techniques. Now, this is the part
Okay.
that people usually miss. They don't exert evidence based learning techniques. Now, what is the evidence learning techniques? There are three things. Number one is to use as concise material as possible. So you don't want to use multiple resources. You want to make sure you use as minimal resources as possible to achieve a high score. And it has been proven if you use too many resources, things get convoluted and then you have a lower score. So that's evidence-based learning techniques number one. And number two would be the active learning. So a lot of people like thinking that they open the book and then they start to read and they think they're learning something. That's not learning anything. It's very passive. You have to draw, you have to say it, you have to make questions, you have to answer like questions, answer questions, Q bank. Those are active learning. A lot of people doesn't really do an active learning. They just open the book and read it. So that's the second. And third one is spaced repetition. Spaced
Yep.
repetition is clearly, yes, the evidence based learning techniques. There is really no reason for anyone to not do a spaced repetitions. Spaced repetitions,
Yep.
I would say, is a must. Now, spaced repetition does not have to be necessarily a flashcard, although that is what I recommend. I recommend
Mhm.
Anki. That's what I use. I use Anki flashcard because it's flexible. You can modify it as you want. So I recommend Anki flashcard, but it doesn't have to be. As long
Right.
as it's a form of space repetition, then it will work. But you have to do a space repetition. You cannot not do. And based on my experience, people who fail in USMA Step 1, and I have a lot of students, I teach a lot of students, and I ask them, did you do any space repetition? They're going to answer no.
Right.
So people who fail, all who fails, doesn't do any space repetition. So that is very important. Now, once you know all of those, then to answer your questions, yes, we would know which one we need to learn, not to learn based on materials. And the materials is very simple. You work first aid, Pathoma, boards and beyond. Period. Done. That's it.
Yeah. Well, I figure you probably haven't heard of our material yet. Our USMLE course actually uses spaced repetition baked in. So it's a really nice supplement to those things and has not just like flashcards, but actual quizzes that you have to answer based on the material. That's cool though. I don't do a ton of self promotion on here, so I won't say much more than that. But definitely check out Achievable's USMLE course also. It's also probably a lot cheaper. Well, so then once you've got materials, and those materials should be giving you analytics, which are hopefully helping you understand what your weaknesses are, and then you're working on those using spaced repetition. Other than that, what are the big things to stay on top of this while you're going through school? Because generally you're taking this test in addition to your schoolwork and everything else.
This is what I recommend. As long as you follow the daily workflow, you can chunk it up with smaller study sessions. My daily workflow is very simple. You watch the video, you make the Yankee cards, you review them. Done. That's it. Watch video, make the cards, review them. And that's just one cycle. Now, so you want to fit that study sessions and you can chunk it in a smaller, like you can do like, let's say if you're open, you can do 4 hours of those, right? Watch video, make cards, review, watch course video, cards, review for 4 hours. But if you are also doing school, right, you can just do 1 hour. Yeah. As long as you watch one video is usually 10 to 15 minutes. You create cards of that, you review them. That's it. It's enough. Why? Because the next day, because of the algorithm of spaced repetition, you'll be able to review the one that you learned before. And then if you keep doing that, you still review the one that you just learned maybe a month ago. So you will not forget it. So that's the beauty of the spaced repetitions. So just chunk it in a smaller study session as long as it follows that cycle. Watch video, review. Or if you do questions, it would be do questions, make the cards, review. And that's it. That's how I would say you put it into on top of your things that you, everything else that you need to do as in the medical school. So,
Yeah, great. So then let's say you get through your step one test and you pass. What do you need to do to prepare for the step two CK next?
yes, that would be very, very similar. Same thing. But the difference in step two is this. Okay. So I always explain people that we don't have to make it complicated. There are only three factors that determine your score. Yeah. First one is understanding the concept. The second one is memorization. And the third one is the test taking strategies or skills, which is basically your performance during the test. So there are only three. There are really only three. So number one and number two, which is the understanding and the memorizations, makes knowledge. And then the test taking skills, meaning the application of that knowledge, the application of number one and number two. That should make sense, right? Now, for USMLE Step 1, there is a lot of heavy emphasis on number one and number two. Not much on the test taking skills because they are all regurgitating the knowledge. Where is this nerve, or what is this gene that actually responsible for emphysema, for example? So it's not a lot of number one and number two, not much on number three. But on the step to CK, it moves toward number three. It's a lot of understanding the context of the question. So you're gonna get people who is not used to it will get confused. For example, in the step one, if you find that somebody has, they give you clinical manifestations of toe being red and painful and stuff, and you say, oh, it's gout, and they're gonna ask you which of the mechanism of action of the medications that prevent these conditions, and then you just choose maybe cyclooxygenase type 1 or whatever that is. So that's very straightforward. You already know what's going to be the answer. But in the step 2 CK, if they have the same question and they ask you what medication you should give, and you're going to see there is an NSAIDs there, there is colchicine there, there's a prednisones, there's probenecid, there is other stuff, and you get confused because all of them are treatment for gout. You see? So then you have to read the context of what should be the best medication for this patient. You need to individualize it, and there's going to be a bunch of data. For example, if the patient have a chronic kidney disease, then you can choose NSAIDs and probably choose prednisone. So you have to understand the context. So it's not enough to memorize, okay, these are the treatment. When it show up, all four options show up. So you need to be able to understand the context of the question. That's why a lot of emphasis is number 3. Therefore, if we trace back, you asked me a question, so how do we prepare for step 2? And the answer is questions. Do more questions. Yes, a lot of questions heavy, which usually we recommend USMLE World. Or Amboss is the second one as alternative. So either UWorld or Amboss, that's usually where we recommend and how people can get a great score. So those are the resources. Do as many questions as you can. And so you just put emphasis on those. That's it.
Yeah, that sounds good. And I mean, CK is still scored, so it ends up being pretty important. How do you feel like CK scores affect your ability to get residency afterwards?
Very, very significant. Very significant. The idea is the program filters the application based on the scores. So if you are 220, then the program demanding a 240, then if you apply to that program, it will be wasted because you are invisible from that program. Your application will not be seen. They just click one button and it's filtered through. So that is the issue, really. Until you reach, I would say 250 is very, very safe. All the programs will be able to see your CV if you're 250 and
Mhm.
above. There is no difference between 250, 260, 270, or 280. I don't think there's really a difference. In my opinion, I don't think
Wow.
there's a difference. As
Okay.
long as it's 250 above, you pass that filter, then they'll look at your whole applications. Yeah,
Is there a difference with top scores though? If you have a
I
very
don't
good
think there
score?
is. I don't think there is. Yeah, I
Okay.
don't believe it. I don't really believe it. Yeah, yeah. So,
Interesting.
but I would always recommend to aim as high score as possible. So even if it's lower, you fell, and you know what I mean. Don't
Okay.
try to aim. I want to get exactly above 250. No, aim as high as possible. So even if you fell, you don't fell as far. So, but as long as you're above 250, you're safe. All the programs will be able to actually see you, whether that's surgery, neurosurgeon, or whatever. Now they look at your whole applications. Mhm.
Okay. Yeah, and then for the last part of this USMLE preparation journey, I'm assuming international medical graduates, even post residency, they're still taking the step three exam as well, correct?
Yes, yes. So you
Yeah.
can take step three before the residency interview, like when you submit for the applications, you can do that, or which I would highly recommend to do. I was kind of like in between about that recommendations for a while, but then I think I start to see more and more evidence that it's very useful to have the step three. It shows that your applications is complete. It becomes preferable for the program that to see that, oh, you have completed your step three. Although it's not super essential, but I do recommend that. Yeah.
Great. Yeah. Do you have any other advice or tips that you would give to people that are preparing for this exam as a international medical graduate?
Yeah, for step one, like I said, it's gonna be exerting those evidence-based learning techniques. Very, very important to do that. Now, for step two CK, one thing that I want to add is that you need to actually step one as well, but more important in step two, you need to simulate the real exam. And I will be honest here, that was my mistake when I did my step two CK. Everybody knows my score. I put it in my YouTube video. So my score is 261, which is a great score, like way above 250 and above 260. I got 261 on my step to CK, but that was actually way lower than my expected score because my NBME was so high. It's 276. So I got really tired at the 7-8 block. I just want to click like stop and then I want to go home. It was too much, it was too much. I was so tired. And the reason is because I didn't simulate the real exam. It was 9 blocks, 8 blocks of question, 1 block of break. So it was 9 blocks. It was a long exam. It's tiring because you have to think all the time. I mean, step one, I don't feel tired at all because I do Anki like pretty much every day. That's just another Anki day for me. But in the step two, I have to think, and so I'm
Mhm.
very tired. So that was my mistake. I only do like NBME and then I do the world self assessment another day. So you have to do it back to back to simulate the real one and to see if you have enough stamina to go for the whole 9 blocks. Yeah. So that would be my final recommendations. If you have done everything right, you make sure you have to perform really well. And so that's just one quick tip. Simulate the real exam. Yeah.
Great. Thank you so much. This has been Board Certified, hosted by Tyler from Achievable with Julius joining us today, Yulius Haryadi. And you can get a free trial of Achievable's USMLE Step 1, MCAT, or other courses by going to achievable.me.